Hey, good morning, good afternoon, good evening to you all. Whatever time of the day you find yourself tuning into this particular video, watching or listening, good day to you. My name is Jerrie'Me Wright, and I'm signing on today as I did on yesterday. However, for some reason, as I stated in that video, that there has been complications concerning me uploading videos or whatnot. It's so funny when someone tried to take your voice away or shut your mouth. Nevertheless, this is definitely something that, I take seriously. Therefore, I'm recording another video today. Speaking on the same thing, which was basically yesterday was dealing with my medical care, as I have expressed on this channel time and time again, how in 2017 I had a ischemic stroke that caused left side paralysis. And I had the care of a physician by the name of Dr. Philip Baldwin at SCOA, that stands for South Carolina Oncology and Associates. However, Dr. Baldwin retired at the end of 2018, and from there on, I saw a physician by the name of Dr. Jill Sullivan. And Dr. Sullivan came from North Carolina. For what reason, I do not know, but I began to be under her care. Now, after his retirement, I went through 2018 at SCOA. I went through 2019 at SCOA, and I didn't quite get through the whole year of 2020. It wasn't until October of 2020 where I received a call from Prisma Health, which they have this department called Sickle Cell Medical Home. And I got this call stating that I have an appointment with them, and I didn't know anything about it, whereby this particular doctor, Dr. Sullivan, actually transferred me over there, without my consent or without even informing me that this is something that, they were going to do. So it kind of lets you know the professionalism, the level or the lack thereof of professionalism that this individual have when it comes to treating her patients. Now, whatever difference or whatever you do not like about an individual, that's on you. Yet and still, when I'm a physician, when I'm a doctor, I'm going to take care of my patient the best way I know how. And I'm not going to actually use someone else as a scapegoat to get out of caring for my patients, which I felt as though that's exactly what she was doing. And before Dr. Baldwin retired, he actually had it set up where I would get these exchange transfusions because of the stroke, and I would get these transfusions so often, whereby they will pull blood from my body and put new whole red blood cells back in my body from those who donate blood. Thank you all. And over the years, I actually had these transfusions, and when the time came for me to have a transfusion, perhaps, in my body, I was feeling fine. And those times I was feeling fine, I actually expressed that to her and the team that, I'm feeling fine. I don't really need, a transfusion. Why be transfused when, you don't need it? So, she actually recorded that as me not being compliant, which is the furthest thing from the truth. Is I'm just not complying to what she want me to do when she want me to do it, I guess. But thing about getting blood is that you can have what is called iron overload, something my sister Monica, God bless her soul, dealt with. She dealt with iron overload, whereby she was getting these transfusions, and the iron buildup in her body actually caused her problems. Therefore, knowing that, I opted not to get transfusions every time I could. And whether she understood that or not, I wasn't there to convince her any other way. But nevertheless, I got transferred to Sickle Cell Medical Home at Prisma Health. And upon coming there, they wanted me to come to have this visit, which I came. I went to my appointment. And, I actually did that for a good year, maybe a year, because there was a period of time where I kind of hesitated about continuing to go there, only because I saw the treatment of other fellow brothers and sisters who have sickle cell anemia. Now, for myself, I am someone who cannot sit by idle and silent and not say something when I see injustice to a group of people or any person individually. That's just not me. Therefore, on Thursday, um, I actually went there to inform them that I would like to be transferred back to my old doctor's office. And upon telling the nurse that and leaving, I actually told her that I would actually, let the doctor and the nurse practitioner know as well through what is called my chart. And I did so. And Friday, I was supposed to get an MRI for my right hip, my right leg area, which I was complaining about because after the stroke, most of my movement and most of the things that I do in my everyday life has been basically with the right side of my body, taking most of the weight, carrying most of the weight. Therefore, April the 8th made 5 years since this stroke, and I'm starting to feel it in my body, whereby my right leg, hip area, and my pelvic area has been hurting continuously, as well as my right arm, which has been hurting continuously. And I was supposed to get this MRI, and 30 minutes before me going to get this MRI, I get a call from the department stating that my insurance would not cover this particular MRI, which I knew was not the truth, because I had already took care of me going, and they actually prefer me to go get this MRI at appointment like that, as opposed to having to go to the emergency room to get an MRI. Therefore, the individual that told me that, I didn't ask. So I started to ask her who put her up to that, but I just saved my breath and said, okay. So she tried to give me this number to reschedule my appointment, which, I told her, never mind. And I had the number already. But, I was just thinking about it, like, what happened? Like, I had an appointment on the 27th, and everything was ironed out. Like, with this appointment, it was rescheduled to May the 6th. And I get this call 30 minutes before stating that, my insurance wouldn't pay for it, which was a lie. And I'm like, why do they feel necessary to lie about something like that? And why do they not want me to get this MRI? And these are the type of healthcare professionals I'm dealing with. And for myself, if they actually take me there, it's gonna be much less talking on my part, and we just have to go about it a different way. Yet and still, as I told my father, I told him, like, you know how many lawsuits, I had over the years, whereby, I could have been paid, like, not just no little lawsuits, but, real lawsuits that, will hold, companies and doctors and physicians accountable, as well as police officers. I mean, I actually have had many lawsuits that would have, gone before the court and would have stand before the court as, a W on my behalf. But as a believer, it's never been my intent or focus to, take anyone to court or, go about it that way. Um, Yet and still, it comes a time that that's gonna happen, whether rather sooner than later. It's gonna happen one way or another. It's gonna happen, and I just prefer to see doctors do what they have to do before patients go that route. Um, but I digress from that, and to go back to being at SCOA and then transferred to Prisma Health Sickle Cell Foundation or Sickle Cell Medical Home at Prisma Health was totally different. And for myself, I'm like, well, I've been at SCOA for over a decade. Like Dr. Baldwin saw me, faithfully, and he actually saw me throughout all the years that I've been at SCOA. And all of a sudden, you have this woman that comes in and actually, sending me to this particular doctor's office that she didn't even inform me about, nor did she, um, give me heads up that, this is your healthcare plan. This is what we're going to do. Now I have this complication whereby one doctor is telling me that he is supposed to take over the transfusions, and he's telling me she is supposed to continue with the transfusions. So it's almost like this dilemma between two physicians. One is saying one thing and one is saying another thing. And I'm like, it really don't matter. Like, the whole purpose is, my well-being. And I'm not going to sit by idle, whereby and have y'all, go back and forth about who's supposed to be over these transfusions. Granted, I do get these transfusions at the same place where I am now, but that's beside the point. If anybody know anything about sickle cell is an inherited blood disorder. Therefore, it requires one to continue to take blood and check labs and see where your levels are, whether it's hemoglobin A or whether it's hemoglobin S. And Dr. Philip Baldwin expressed this to me before he retired after the stroke. He said, our plan is to have your hemoglobin A below 50% and your hemoglobin S above 50%. And, I kept that in mind, and I'm like, well, that makes sense to me. A should be below 50%. S should be above 50%. And I get around and I have this doctor who basically, when I started seeing her, I didn't even see her. She wouldn't even come in the room to see me. It would be the nurse practitioner, Andrea Oates, that would come in the room and see me. And Dr. Sullivan wouldn't even come in the room as far as to actually see me. So it's almost like, I'm a patient there, but I'm not actually seeing my doctor. I'm seeing the nurse practitioner. I saw the nurse practitioner uh, over half of my visits there. And I perhaps can say I saw Dr. Jill Sullivan maybe 5 times out of the couple years and a half I've been there. 5 times out of the time that I've been there, since she's been there as well. And it becomes frustrating for myself because I'm like, well, hey, I'm not just dealing with sickle cell anymore. If it's sickle cell, I understand, I can bear that pain at times. But what I'm dealing with now is a result from the stroke. So I have this stroke whereby I have to actually do more with my right hand, and I have to actually bear the weight with my right leg more often now. Therefore, this pain is not just sickle cell pain. This pain that I feel in my hip is basically pain that has been caused from over time having to carry most of my weight on the right side. Nevertheless, I'm going to end by saying this to someone. And the reason I share these stories with you about me personally is that one, it helps me to get it off my chest. Two, it may help someone else who may be going through the same thing. And you never know what someone is going through until you actually tell them. So I hope that this will be able to help someone who may be going through the same thing and they're actually given the runaround by their doctors. Take care and be blessed, you all.